दीपेश सर, आप कुछ कहना चाहते हैं? You've raised your hand.
He's adjusting himself.
नहीं शायद गलती से हुआ है कि
दीपेश भाई चैट बॉक्स में તમારો hand raise થયો છે.
So we are live now.
Oh yes, we can start.
Okay, so good evening to all respected delegates and faculty members who have joined this webinar. I'm Nilesh Darji from Corona Remedies. Welcomes you all in this 164th edition of Happy Learning Masterclass webinar series in association with State Organization of Gynecologists and Obstetricians of Gujarat and jointly with Ahmedabad, Gandhinagar, Himmatnagar, Mehsana and Palanpur. The theme for today's webinar is mixed bag. And today's webinar's convener is Dr. Asha Jain. So let me introduce Madam. So Madam, Dr. Asha Jain has very vast 32 years of experience in obs and gyne therapy. And Madam also has a FOXI recognized ultrasound training center and colposcopy training center. Currently, Madam is Director of SMSA Hospital, Raipur, Medical Director, Cancer Prevention and Relief Society, elected member of Chhattisgarh Medical Counseling, Vice President, IMA Chhattisgarh, and Madam's field of interest are saving the uterus, fetal medicine, obs and gyne ultrasound, critical care, and preventive oncology and colposcopy. So I welcome you, Dr. Asha Jain, Madam. And as per the traditional course, I would like to start this webinar with a digital lamp lighting session. Thank you so much for your patience. Now I will hand over the session to Dr. Asha Jain, Madam. So over to you, Madam.
Thank you, Nilesh. Namaskar. On behalf of Happy Masterclass, I welcome you all. And as the director, Dr. MC Patel sir is very well known to you, but still I would request him to actually formally invite everyone for this webinar. Over to you, Patel sir.
Yes, thank you, Dr. Asha. It gives me immense pleasure to welcome you all on 164th episode of Happy Learning Masterclass, and it is with Sugog and all the society just mentioned, Ahmedabad, Gandhinagar, Himmatnagar, Mehsana and Palanpur. So I welcome Dr. Atul Munshi sir, who has kindly consented to be chief guest to bless us for this webinar. Of course, Atul bhai is always with us in any of our academic activity. So welcome, sir. I also welcome Dr. UC Vasavda sir from Mehsana. He is also always with us in any of our activity. He has kindly consented to be guest of honor to bless us. And same way, Dr. CB Nagori from Ahmedabad. He has also kindly consented to be guest of honor to bless this webinar. So I welcome all the guests, Dr. Atul Munshi, Dr. UC Vasavda, and Dr. CB Nagori. I also welcome Dr. Kamini Patel, President Sogog. She is joining very soon. So I welcome Dr. Kamini Patel, Madam also. I also welcome today's learned speaker, Dr. Haresh Doshi. He is going to discuss very interesting situation, nightmare situations in labor room. I also welcome three chairpersons who are going to chair that very important session. Dr. Mahendra Soni from Himmatnagar, Dr. Jignesh Shah from Ahmedabad, and Dr. Dipesh Dodakia again from Ahmedabad. I also welcome all the learned panelists who have kindly consented to be panelists in reverse panel today panelists will be asking question, and being a moderator, I will be answering the question. Dr. Mukesh Savalia and Dr. Mukesh Patel from Ahmedabad, Dr. Priyanka Sinha from Gandhinagar, Dr. Sandeep Patel and Dr. Sapan Doshi from Himmatnagar, Dr. Mukund Patel and Priyanshu Patel from Mehsana, Naresh Prajapati and Dignesh Balakia from Palanpur, Dr. Dinesh Patel from Himmatnagar, Dr. Sanjay Dharani from Palanpur, Dr. Hemant Bhatt from Ahmedabad, Dr. Jignesh Deliwala from Ahmedabad, Dr. Kiran Desai from Ahmedabad, and Dr. Fagun Shah from Ahmedabad. I also welcome Dr. Asha Jain, who is convener in this series since long. She is past president of Raipur OBGYN Society. So welcome, Dr. Asha. I also welcome Dr. Rekha Rajendra Kumar. She is coordinator in this series since long. She is president-elect of Bengaluru Society. So welcome. And I welcome all the president and secretary of respective societies who have joined this webinar. In era of COVID, when physical meetings were not possible, I started this series and I invited 3 friends, and with 4 friends, we started this series. And now we are in 164th episode of Happy Learning Masterclass web series. And we have completed our 3 rounds of all the Society of Foxy, and this is our 4th round as far as our journey to Foxy societies are concerned. Usually we go with any focus topic and related to that medico-legal topic and one panel. But in 4th round, we have changed our module, 1 lecture and 1 reverse panel. So in reverse panel, panelists will be asking, and being a moderator, I will be answering. So with this, we have started this. Ultimate goal at that time in COVID was to meet our Foxian friends on virtual ground, to discuss focus topic, to be helpful to our patient, and ultimate goal was to check maternal and infant mortality rate, because government of India has given us a target, even WHO has also given target, by 2030, maternal mortality should be less than 70 and infant mortality should be less than 12. Of course, there are so many societies in southern India, they are nearby 30. Of course, Gujarat is also doing well. Gujarat is also 53. But there are few societies in northern India and particularly in northern eastern India where maternal mortality rate is near 200. And it can only be checked with joint hand only. Government on part of government, then NGOs, then organization like IMA, Foxy, and our Foxian friends, obstetrician friends, particularly who are working in very remote rural India. And if they take patient well in time, picking up high-risk cases, and if they can be referred to a appropriate center at appropriate time, that maternal mortality and infant mortality can be checked. So with this aim, this series was started, and I am happy to announce now it is 7,000 plus member family of Happy Learning Masterclass web series is concerned. So without wasting much of your time, welcoming you all to this 164th episode of Happy Learning Masterclass. Thank you very much.
A small request to Dr. Asha Ben. Keep the introduction minimal because everybody knows each one. Yeah.
Yes.
Thank you.
Right.
Thank you, sir. Rekha ma'am,
Yeah, please tell me.
introduce Munshi sir.
Yeah. Mr. Nilesh, can I have the CV of Atul Munshi, sir? Sir, Atul Munshi, sir, we are so happy to have you as the chief guest. It's our proud privilege to have you here. Sir is a consulting obstetrician gynecologist and director at Munshi Group of Hospital. Sir was a former professor and HOD at GCS
That's okay, madam.
College
Don't treat everything.
and president of IMS in 2020. Thank you, sir. It's a very brief introduction of yours. We would like to hear from you.
Thank you for kind introduction. Good evening, friends. When I saw the first flyer of the webinar, it looked like a virtual mini Sogo. The stalwarts of Gujarat, its speaker, chairpersons, and panelists. Here I see Dr. Vasavda, Dr. Nagori, Dr. Mahendra Bhai Jignesh, Dr. Dipesh Bhai Dholakia, and above all, Dr. Harish Doshi, my old friend and one time my boss at DCS. Our evergreen MC Patel with unique idea has started this long back, simple yet versatile personality. Happy Learning Masterclass is exclusive brainchild of Dr. MC. Today is 164th edition. Just fascinating. This academic wagon has virtually traveled almost all parts of India. And today I know that it has traveled 3 times. Now it is the 4th round.
Yes, this is 4th round.
From east to west and north to east. निकले थे हम अकेले, लोग जुड़ते गए और कारवा बनता गया. An unbeatable force of the purpose for his fighting. Today's topics are also very interesting and touching all obstetrician in daily practice. Dr. Harish Bhai will be talking about nightmare in the labor room. Will scare us also, but he is very humorous also. So will tell us in light blue. So our reverse panel, which is also a brainchild of Dr. Chairpersons, today is talking about POSCO. MC Patel will be answering the thing. POSCO is a chakravi for all of us. Let us clear all doubts from the experts. Wishing all the best to Dr. MC Patel for whatever endeavor is go and today's webinar. Thank you very much.
Thank you, sir. Thank you for sparing time to bless us. Of course, you are always with us in any of our activity, and mere presence of your is enough to inspire us for any of our activity. Thank you, sir.
Thank you, Atul Munshi sir, for blessing us. Your presence itself is an esteemed time for us. Thank you so much, sir.
Rekha, proceed with the second.
Yeah, Mr. Nilesh, can I have the CV of Dr. Vasavda, sir? Upendra C. Vasavda, sir. Yeah, sir has given a very short CV of his. We have invited sir as a guest of honor, and we are happy that sir has accepted our invitation. He's a gynecologist from Mehsana, past president of SOGOG and Mehsana Obstetrics Gynec Society. Sir is also superintendent and worked as a superintendent of Lions General Hospital of Mehsana. Sir, can we have some information from your side and advice from your side, sir? Over to Upendra, sir.
Yes, Vasavda, sir.
Sir, we can't hear from you.
Somehow there is an audio problem.
Yeah, there is some audio problem.
ના તો મોબાઈલ થી જોઈન થઈ જાઓ વસાડા સાહેબ, લેપટોપ થી ના થતું હોય તો.
Vasavda, sir, you're talking, but we can't hear you, sir.
You are not audible, Vasavda, sir. So you can log out and log in again. Till then, we can.
Sir, 1 minute, sir. No, sir, we can't hear from you.
Rekha ji, take the third person.
Yes,
Meanwhile,
yes.
this
We
will
invite
happen.
Dr. Nagori.
I know. I thought I'll give him some time because he was putting the.
No, we'll take after.
Yeah, okay. Can I have Dr. C.B. Nagori, sir? Who does not know Nagori, sir? Sir is well known for his high results of fertility, making the UPT positives with the IUI treatment itself, not allowing them to go for IVF. The simple treatment made the magic hands and his magic wand of transvaginal sonography. Many of his patients turn UPT positive. Sir is the director of Nagori's Institute of Fertility and IVF from Ahmedabad. Is the first stem cell pregnancy in India, first ever center of excellence for Anne Donald School of Ultrasound. He holds regular trainings in infertility, IVF and ultrasound. He holds Gujarat University recognized fellowship programs again in infertility and IVF, and contributed and has many publications to his credit. C.B. Nagori, sir, can we hear from you?
Yes, thank you very much. Can you listen me? Thank you very much, madam.
Yes, sir, we can hear you.
Yes. Thanks a lot, madam. And I wish the brilliant success for the program. And I can tell only one thing, that MC Patel is a very good organizer. And I'm sure he is our future president also. I wish him good and success for his tenure also.
Thank you, sir.
And he's conducting very, very nice such webinars, and a lot of knowledge is imparted to all the people. So I wish all the success, MC, my very dear friend.
Yes. Thank you, sir. Thank you for sparing time. You are also good old friend and you are with us. Thank you.
Thank you, Nagori sir, for your esteemed presence and words of wisdom. Thank you, sir. Dr.
I
Asha,
think Savda sir is there now.
Vasavda sir? I can't see him. Means Vasavda sir? It was there now again, I can't see him. I think we can proceed, Dr. Asha.
Okay.
Yes. Yes, we can proceed and
Okay.
whenever he joins, we will have blessing at that time.
Yes, sir.
All right, sir. So, sir, with due permission and thanks for all the dignitaries who have joined us for the inaugural function, I request for the CV of our chairpersons, Dr. Mahendra Soni, sir, Dr. Jignesh Shah, and CVs. Yeah, thank you. So, Dr. Mahendra Soni, sir, as Munshi sir said, I will be taking really very short CV. So he is the president of SOGOG in 1995. He's a private practitioner at Himmatnagar. He's a member of many NGOs and social service organizations, and he has participated in many things. Moreover, he has a special interest in critical obstetrics and infertility. Welcome, Soni sir. Next, please. Next CV, please. We have Dr. Jignesh Shah, sir. He is a senior obstetric gynec practitioner in Ahmedabad. We all know him as the past president of IMS, where he made IMS really very, very active. He was the past president of Ahmedabad Obstetric Gynec Society, member of many societies, many organizations, many lectures, and his center is also recognized by FOXY for basic and advanced ultrasound training. We have Dr. Deepesh Dholakia, sir. He's the secretary of SOGOG, ex-associate professor at NHL Muni Medical College, Ahmedabad, past president AOGS, and organizing chairperson of AICOG. His special interest is difficult NDVH and high-risk obstetrics. Welcome, respected chairpersons. Over to you now to start the session and introduce Haresh Doshi, sir. CV of Haresh, sir. Over to you, chairpersons.
Dr. Mahendra, can you introduce?
Mahendra Bhai Soni.
Yes.
Introduce Dr. Haresh Doshi.
Yeah. So, good evening to all the friends. Not taking much time, and I would like to introduce Dr. Haresh Doshi. As everyone knows, Dr. Haresh Doshi as a teacher, and sometimes is called the teacher of the teachers. He is a professor and head of the department of obstetrics and gynec at GCS Medical College. He has many publications on his name. He returns books, and his books are also read by the final MBA students also. His faculty more than nearly 200 times in national and international conferences. He was our organizing secretary for AICOG 2000 and FOXY conference chairperson.
It's okay, Mahendra Bhai.
Now, main thing is very much interested in critical obstetrics. So please, over to you, Dr. Haresh Bhai.
Well, please bear with me because I'm not computer savvy. I will require some time to share the screen. Right. Okay.
Haresh Doshi,
I
sir.
share. Yes, madam.
You keep coming every year to Bangalore for the PGCM.
Yes, madam.
Yeah.
Thank you for calling me. I will come.
Yes, we invite you every year.
Okay. Fine. Yes. I should make the. Is it same? My screen is same.
Yes, make it full
Yes, sir.
screen.
You need to make
Okay.
it full screen.
Okay, I'll make it full screen. It is there. Same now.
No, sir,
No,
not
sir.
full
No,
screen
still
yet.
it
No,
not
then
full screen.
then I have to.
Bottom right corner, bottom right corner.
That I have done. That I have done. I know, but that is what happens in my laptop. That I have to first stop share and then again share screen and make the presentation from this. From which one I would say 14 September. Post attendee Zoom.
Mhm.
Okay, share. Again, I will do that because it requires sometimes, right? And again, I will make full screen. It is coming in my full screen. In yours, no.
Nice, sir.
My laptop, it is coming as full screen. Resume share. Okay.
You will have to
Stop
open
share
your,
first.
Harish bhai, you will have
Yes.
to open your presentation, minimize and then log in. Before log
Yes, yes.
you have to
Okay.
do that.
No, login will take time, sir. Login will take
Sir,
time.
ऊपर वो slideshow है ना, sir? ऊपर, the top bar.
No, no,
You can see the
it won't
slideshow
work.
next to animation.
Next to animation, slideshow. Okay,
Ah,
I'll do
yes,
that
sir.
from current slide. Now it is coming.
No,
No.
it won't come.
Ah.
Before you log in, you have to open your presentation. It is to be minimized,
Done
and
that.
then only you
Okay,
have to log
okay,
in.
okay,
Then
okay.
only it will come full screen.
No, but I will have to leave and log in again? No.
No, but if you can manage with this, it will do.
Okay. Uh,
Sir,
let me
जो है
check.
उसको you
Yes,
keep
yes.
moving the slides, no problem.
Yes, I'll
हाँ,
open.
correct. अभी आ गया.
लेकिन मेरा slide.
Now full screen है,
Now
sir.
it is full screen.
Okay, thank you. Thank you very much. Okay. Honorable Chairperson Munshi sir, I mean Chief Guest rather.
सर का freeze हो गया.
Not
Voice is
audible.
not coming.
हरेश सर आपका freeze हो गया.
He's not audible.
And his photo is also still. Harish sir, you can hear from us?
We might be trying to log out or something.
I
His
think it's
internet
logged
connection might have been interrupted.
He can send it to Nilesh and Nilesh can present it.
Yes, I can do it. Should I call you?
Yes,
You
please
can
do it from
call.
your side.
Better.
Okay.
Until then, Dr. Vasavada sir is there.
Yes.
We can take his
Ah.
Yes,
blessing.
we can have blessings from him.
Vasavada sahib, unmute kar do. खाली.
Thanks, Dr. Hemant, but for timely input and advice.
Sir,
Vasavada sir,
unmute kar do, sir.
Please
Vasavada
unmute.
sahib.
Harish
Bas,
sir,
bas. Now you are
can
audible.
send it to Mr. Nilesh of Corona so that you can peacefully talk.
नीलेश तारी पासे प्रेजेंटेशन है तू चालू कर दे ने साहब ने
Hello.
कही दे sir you are audible
And it is seen also.
yes but you can
Okay, I was making a comment.
you have to
No.
make
Not in full screen.
slideshow.
Slideshow. It is slideshow only in my laptop.
Yes,
no,
not
it
full
is
screen.
not full
चलता
screen.
है sir. You
But
can
if you
नहीं,
can
again
manage
नहीं है.
this, it will do.
full
नहीं,
screen on साहब થઈ जैसे
नहीं करूँ to stop share. Again, I will share the screen and I will make the nightmares situation. Now,
yes
Now it is
बढ़िया.
full
It's
screen.
fine.
perfect
now it is there.
Go ahead.
पहले
Yes.
से शुरू कीजिए बस.
अच्छा, okay, I'll go that way, right? अरे बाबा ये प्रॉब्लम हो रहा है. It is not
सर
moving.
आपका जो था ना वैसे ही प्रेजेंट कीजिए या आप देसाई को भेज दीजिए
Okay, I was making a comment on MC Patel. I was seeing the pics of all faculties. Which, the mustache of MC Patel is very peculiar. Now the word will come as Muche Hoto MC Patel Jaisi. As Dr. Nagori said, and Mansi sir also said, congratulations, Dr. MC Patel, and we want you as a Foxy president, right? With thumping majority. Well, I will straight away start my presentation. Although delivery is a natural process, sometimes severe complications occur unexpectedly. That we know, as they are very rare, and some of them occur without any predisposing factors or warning signs, they manifest as nightmares for us. Initial response to any complication in labor room when we are delivering the patient is immediate resuscitative measures. We always tell and teach, ask for help. No, when severe emergency occurs, you have to shout for help. Shouting, not asking, not requesting. Mobilize other resources. That is very well. That is always there. Now, in this short time, 20 minutes, I will be discussing in very brief these 8 situations: PPH, APH, shoulder dystocia, eclamptic fit, retained placenta, acute inversion, cord prolapse, sudden postpartum. All are known to everyone, but just I will have few points or comments in each. Severe PPH, when you are taking the subject of PPH, it occurs 5 to 10%. But what is important? Severe PPH, it occurs hardly in 1 to 2%. And nowadays, atonic variety is most common because we have almost stopped doing, my resident students have stopped doing instrumental deliveries and difficult deliveries. So traumatic PPH has gone from 25% to 10%, less than 10%. So most of our PPH is now atonic PPH. And up to 60% of cases, we all know that this PPH, dangerous complication, occur in low risk patients. So every patient you have to be ready. All this bottom line is important. All alcoholic drugs, oxytocin, methergine, prostaglandin, and all this should be kept in a refrigerator. All will lose some amount of potency if it is kept in a room temperature. This is I put because I have just come last year published this document with company that room temperature carbetocin. I am very much fond of this, and in my medical college and in my private hospital, all cesarean, like Canadian and Australian Society guidelines, all cesareans, carbetocin is given without waiting for PPH as a management of 3rd stage of labor. So carbetocin makes the uterus stony hard. We have now 80 plus cases. So this is important. Carbetocin is a better drug because it is long acting, no water retention, and most important, heat stable. Tranexamic acid, everybody teaches, everybody knows. Misoprostol is for simple AMTSL, not for PPH and not for severe PPH. You can do. Normally, what we do when we are in panic, we use all the drugs. Okay, that cocktail, it works. But what is important in misoprostol is a weak drug, you must remember. All other drugs are potent drugs, oxytocin, methergine, carbopros, and this carbetocin also. Well, this line is important. I cannot discuss PPH, all points. This is most important. Pressure is the most important method of hemostasis. Pressure from inside, balloon tamponade, packing. Mahindra Soni has a vast experience of packing. Mini sponge is a new device which has come. Pressure from outside, binal compression suture, various compression sutures. Negative pressure from inside, suction cannulas, SR cannula. And now the American people are very smart. They may commercialize everything. So they have devised from this cannula, JADA system. That is the FDA approved system. Again, it is suction cannula only. Negative pressure from inside. And genius people do it combined, that is pressure from both sides, inside and outside. This is called sandwich method, balloon from inside and sutures from outside. So what the point I wanted to draw is pressure is the most important method of hemostasis. I may not be going in detail of all this, couple of these new things. Use balloon tamponade. Now it is coming up because when there is no PPH is treated by PPH bundle, right? Primary bundle and then refractory PPH. Used when first response to PPH bundle, that is uterotonic, crystalloids, tranexamic acid, and uterine massage are not effective in controlling PPH. FIGO as well as WHO 2021 has clearly mentioned UBD as a second line treatment for severe PPH. All these balloons, you know, Sangstekan, Bakri, Roche, but we have an indigenous from in our country, Sivkar Pak, Nalini Mishra, Sai Bhakta from Bangladesh. You can make it from right condom, but again, that you may require some things to assemble. This ESM, every second matters. ESM, uterine balloon tamponade, is a device. Again, American people have come down with. Dr. Kurke from USA has come down with this. This is right, not very costly. You can keep one pack in your side. So at the time of atonic PPH, you do not have to assemble and waste time in that. Everything is there. If my video works, let me see. Yeah. So these things are kept in the trolley and all things are supplied. Catheter, condom, that O-ring, right? 60 ml syringe. You have to just take the saline or water, plain water you can take. So this is very right, easy to make, right? You can see that hardly 2 minutes will happen. May take a O-ring, apply it again, and to make it very tight, right, leak proof, and then inject the fluid in the catheter. Before injecting, you have to put this catheter as if you are doing PV, and I'm just mentioning this like 2 finger, gradually inside the uterus, and then outside the, normally we inflate the Foley's catheter, right? Normally we inflate the Foley's catheter, like that we inflate with the fluid. And on the left side, here it is there, this is just 80 ml. You can increase up to 300 to 1 liter, right? So this is right specialized, available, packed, everything in one pack. You have to purchase it, keep it, right? So that's how, right, you can increase. This hardly takes 2 minutes. It's a live video you can watch. So you can try this. It is diagnostic as well as therapeutic. If the bleeding continues, you have to maybe switch over. It is not tamponade, not effective, or bleeding stops. It is therapeutic. So that's how this works. I will move to next slide. So very simple. Dr. Burke's ESM, every second matters, balloon tamponade by Pregna company. Okay. This is another right genius device by Samatram. This is very well used in South India. North India, the people are not ready to accept it. A simple technique, right? Takes very little time to organize because you have to have suction machine in your labor room. You can put the cannula inside just because different cannulas he has improvised as per experience. In cesarean section, in vaginal delivery, right? You have to remove the cannula after 6 to 24 hours, but it stops bleeding within 3 minutes. This balloon tamponade suction device are very fast, right? Very easy to use, right? And every 10 minutes, every hourly, you have to keep the negative pressure. Then you can switch off the negative pressure also. Uterus and cervix sticks to the cannula. And I've seen, because we have used in 6 cases in our labor room, and 5 cases it was successful. In 1 case, we had to do laparotomy and vessel ligation, but no hysterectomy. But this was, and it gives you time always, decreases the blood loss. It is a simple vacuum MTP we are doing. It's same, the uterus contracts and grips and vessels are compressed and bleeding stops. So I'm not going in further detail, but again, the compression, my principle of pressure, here it is aortic pressure, right? Aortic compression is simple and effective. L23.
Hello.
Yes. L23. Sorry, it was Jignesh voice. So below the renal artery, here there is a right arrow that is below L2, L3, L4. You can put this right your hand and then right. So aortic compression I'll be showing you. Non-pneumatic anti-shock-garment, WHO has done studies in our country, but that you have to keep it in your labor room. Again is the pressure in the lower limbs, right? Pressure in the lower limbs. So this probably a video works. This is how, above the fundus, you can push your face and press it as hard as possible and check the pulse, femoral pulse. It should get up. It gives you very much time. You can 10 minutes, you can press the aorta. I've done in couple of cases and very useful till you mobilize the other resources in labor room. Well, After taking all these manipulative methods, we have a surgical methods which are very effective because it directly occludes the vessels. I will not go in detail of that. Only one word for this: bilateral uterine artery ligation does wonder. You can do it on both the sides, bilateral, and 2 times in one side, right? Slightly below for descending cervical if you are worried for lower bleeding, or at least one on each side. It does wonder. Even if you are proceeding for hysterectomy, you can first do uterine artery ligation and then proceed. The blood loss will be less. Okay, this last sentence is important. As I told, Mahendra Soni is famous for packing. I would say Dr. Deliwala, not Deliwala, and Dr. Jignesh Bhai and Dr. Tolakia have lots of experience of saving the patients by doing hysterectomy in time. We have now many options available. Hysterectomy is the final answer, and you cannot try on patient when the patient is in serious condition. You are accustomed to hysterectomy operation. You can straight away proceed for them, at least if the patient is one child alive. Traumatic BPH. This is my topic because I do lots of instrumental delivery. Continuous bleeding after the uterus is contracted indicates traumatic component, vaginal tears, exploration of cervix, episiotomy, hematoma. This is important, right? Ask the assistant to pull the whole uterus for vaginal tears above from abdominal root, hands on suprapubic region. You can see this, right? On this side, I'm doing this, right? I think the video is also there, right? Okay, this is the 2 ways from the head side, and you push the uterus up, You can easily, postpartum uterus is very mobile, and then you see the vagina is converted to a big room. Every small bleeder usually is very easily visible. You can tackle it very nicely. This is simple maneuver part, pushing the uterus for abdomen high up, and then you can see the whole vagina, right, with proper light. For cervix, you have to do the reverse. Gently push the fundus down from abdominal root, right? This is the way of pressure, right? And now the cervix, whole uterus is pushed down. Cervix will be at your doorstep, right? You push the speculum and at introitus cervical, there is that. Nowadays, I teach my students not to use 3-swab technique for, checking the cervical tear, right? You can do it by simple visualization, and then you can take the suture. You just slightly push the fundus for abdomen. Episiotomy, hematoma. Medium and large ones requires exploration, copious saline irrigation with force, jet. 1 liter pint. So if you have more force, right, not 500 ml, right, and you require 2-3 pints, all clots should be drained. This line is important. Clots look like tissue. After some time, it takes the texture of tissue. Right? Mistake if you leave it behind. You should remove that also because they are clots. And on the other side, the blood stains the tissue. Mistakes if you try to remove the muscles. Some perineal muscles may be there. So don't do that. Right? Let the saline wash out the clots. The tissue will be tissue. Clots are washed out, and you can tackle the things. Okay. So big vulval hematoma. Bleeder may not be always found. Bleeders which have caused hematoma might have stopped bleeding due to pressure of hematoma itself. And hypotension somewhat has occurred. So every time I have explored the hematoma, I have not found the bleeders. Better to keep drain and suture. Right? Not always, but better to keep drain and suture. Tight vaginal plaque. Again, a pressure hemostasis and tight vaginal plaque. The bottom line is important. Hematoma is always bigger than you think, bigger than you wish, because ischiorectal fossa can collect a huge amount of blood. I'm taking a break. You have to give me the answer. Those who have joined in this webinar, right? Which, because compressions which I have not taken in detail, P-Lynch, Heman, Donacilla, Pereira, Hakatal, Lion, Makino Takeda, Masinge, Jang, Como. Which of the following is not the compression suture? You give your answer either A, B, C, D, E, F, G, H, J, H, I, C, D, and WhatsApp or text message. The first 2 will get the handsome prize. I will courier the prize to them. My number is known to everybody, 98250-60125. Which of the all are compression suture, but one is not. P-Lynch, Heman, Gunasilla, Pereira, Hakatal, Wayne, Nakino Takeda, Masinge, Zhang, and Komok MG or Mahesh Gupta. Okay. retained placenta. Rarely MRP is extremely difficult, right? Every third or fourth MRP will be difficult. Remember, in difficult cases of MRP, deepen the level of anesthesia, introduce full forearm, not only hand inside. Normally you pass the hand just above the cervix and you think placenta will come. No, whole forearm. Stop oxytocin if the uterus is contracting much and wait for uterus to relax. Stabilize the fundus by external hand. It may go up to the diaphragm, right? Passing the hand outside the membranes, when there are membranes which are ruptured and the baby has come out from the amniotic sac, it is easy to reach the placental edge. This bottom line is a very good tip, right? I found it very useful. So this is not the way you are only just hand inside the vagina. This is the whole forearm in the deep in the uterus. Then and then you can reach the fundus. Then and then. Shoulder dystocia. It occurs as nightmare, as 50% of cases are again like PPH occurs in absence of risk factor. Clinicians should be alert to in the possibility of every, not only diabetic or macrosomia, even normal 3 kg sometimes cause bed. Mac-Roberts maneuver with suprapubic pressure resolve 90% of cases, 90%. I always tell my resident to remember this. Hands are my, right? Extended and abducted and rather flexed. So Mac-Roberts maneuver will take care of 90%. It involves hyperflexion, abduction, and external rotation of the thighs. So this is the way, right? Because hyperflex, that's why the foot is also pushed. Hyper, not simply flex, hyperflex. And then press the shoulder on the side of the fetal face, on the side, not simply posteriorly, slightly oblique, and that will take care of you. Mnemonic is there. We were teaching the shoulder tissues of many mnemonics, helper, right? All these are there. But remember, these procedures are not easy, right? Rubin's maneuver and corkscrew maneuver and reverse corkscrew and all that, right? Javanali and all that. These are not easy to practice, and by the time baby is dead. So don't then go for heroic procedures. And sometimes baby is dead, you can do cleidotomy, can be done. In this helper, the last R is rollover. This rollover on fold 4, gasket. Patient ko ulta sulana. See, I am there like, I just check whether it is feasible or we can. It is very tiring for the patient. So when I did this, my resident was right surprised. What sir is going crazy? What sir is doing? But this is difficult. Gasking is not. So all other maneuvers, we need not be right that successful. This for exam, MS exam, just Mac-Roberts, Mac-Roberts, and Mac-Roberts. Cord prolapse. It's a pure fetal emergency. 5 things we do: oxygen, foot and raise, filling the bladder, right, to make the uterine contraction less, left lateral position, and tocolytics. Do not remove hand from vagina. Replace the cord back in the vagina if it is outside. But don't try to push it in the uterus above the cervix. Fiddling the cord will causes contraction. So just avoid the pressure on that cord. It may remain in the vagina. Still the body temperature is there. Good. Right? Put the fingers on the presenting part and keep it pushed upwards during contraction. This is important. Don't try to put it back in the right uterus. If it is alive, cesarean section, remove vaginal hand only on operation table. If fetus is dead, then vaginal delivery. But here is the catch. If cord pulses are not felt, check fetal heart sound by Doppler. Below it may not be there. In vaginal hand, you may not feel. But if you put a probe, and always remember, now sonography has many intrapartum indication, labor room indication, right? Intrapartum, first stage, second stage, you can do. Sometimes you cannot make out oxypropose here, you check, right? That sonography machine is very helpful. Now, many indication of labor, not antenatal sonography. If cervix is fully dilated, very rare condition, then cord to come. But then I do forceps. I have done that. Be careful in doing ARM in non-engaged head. Right? Sometimes 4 or 5 centimeter head is not fixed. It is still floating. You want to avoid cord prolapse. Then you should not do precipitate. So double right pressure. Suprapubic and fundal. And puncture with not big instrument occurs of this. Only needle puncture. It will not tear or burst out. And then the cord prolapse should not occur. Control. Very well controlled. Eclamptic, I need not mention in detail. It can occur suddenly even in a case of mild hypertension. And particularly it can occur postpartum also. I have a couple of cases, doctor also, twins, cesarean section done, mild hypertension, third day, sickle ones, postpartum. The third day everyone become casual. She had taken tablet labetalol, but it convulsed, and then we had a very bad time, Maxell for 24 hours. So they remember that it can occur first time in postpartum also, not in labor room. After initial measures, Maxell is given, termination of pregnancy is done, irrespective of gestational age, once the patient condition is stabilized. Nothing like intercurrent eclampsia in modern obstetrics. Right? 7 months, 8 months, 9 months, fetal survival, not survival, immediate cesarean section. Direct CS without induction is indicated when fetus is mature and alive and cervix is unfavorable. Naturally, for status eclampticus, you will anesthetize the patient and cesarean section. Right. APH, I have not taken placenta previa now. Well diagnosed during pregnancy, you manage, you do in placenta accreta also, 34 weeks, 36 weeks, we terminate to cesarean section. Abruption can occur in a labor. That is a labor room nightmare. Severe abruption may occur unexpectedly. Be vigilant for hypertension patient when we are conducting the delivery. Now for hypertension also we are doing cesarean section. But sometimes we allow labor, then shock is out of proportion. And again like eclampsia, early delivery, immediate delivery. Right? Always. Augment the labor by ARM and oxytocin for vaginal delivery if patient is in active labor already or more than 4 cm dilatation. But don't wait for long. Do cesarean section if peak vaginal delivery is unlikely, even if fetus is dead. To dangerous complication of abruption, that is ARF and coagulopathy, are directly proportionally related to abruption delivery interval. 8 hours, more chances. 4 hours, you have done cesarean, less chances. Right? So nowadays with good blood product and blood available, we are doing cesarean section for more than very mild abruption. Always cesarean section. Acute inversion of uterus, very rare, right? First step is in treatment of inversion is immediate replacement. If you are lucky, you are diagnosed on table, on labor room. Shock is out of proportion because a neurogenic component. Reduction under deep GA is required. See, remember one of my advice, my personal experience, whenever you do GA procedures like retained placenta, inversion, IP we are not doing, but all 3 procedures, don't give up. Have some seconds. Ask anesthetists. My hand is not moving inside the uterus. It clicks. Sometimes it clicks after 10 seconds, uterus becomes relaxed and you can do the procedure very easily. So don't give up placenta nickel nira. People have done for retained placenta also laparotomy, cesarean section. Not required. You can, unless it is a adherent placenta, morbidly adherent placenta. So you can wait and then suddenly your hand will go inside, and that is a good thing in GA, right? Acute inversion, at times squeezing the uterus with all fingers in the vagina and using it as a piston, exerting pressure inside the ring of the contracting ring of inversion can help in reposition. Failure in reduction naturally will require surgical correction. Suspect incomplete inversion if patient is sudden postpartum collapse. The last right thing, sudden postpartum collapse. Maternal collapse is defined as an acute event, definition-wise, involving the cardiorespiratory system and or brain, resulting in a reduced or absent conscious level. If not tackled in time, it can result in death also. We are more concerned with pulmonary embolism. Pulmonary embolism can be due to blood clot. Our domain is amniotic fluid. Also blood clot, also DVT also. Air or fat is rare. Amniotic fluid embolism again very rare. Chest symptom, respiratory symptom, tachypnea, dyspnea, chest pain, cough, hemoptysis. You should always right tubulate થઈ જોઈએ ત્યાં તો embolism થયું છે. Sudden collapse and respiratory gasping and tachypnea, right? All this. In massive pulmonary embolism, there is sudden onset of syncope, hypotension, then cardiac symptoms, cardiac things. But otherwise, respiratory symptoms, then it should give you the hint. Our amniotic fluid embolism can occur 30 minutes within birth time, right? After initial resuscitation, naturally multidisciplinary approach, anticoagulants, you should keep at least one right vial of unfractionated heparin or low molecular in your labor room. The management of amniotic fluid embolism is non-specific. It is supportive treatment, right? There is no proven effective therapy. Support this. Do anticoagulant give or very rarely embolization. Embolectomy you may require if the patient is stabilized on ventilator and in ICU. Apart from obstetric causes, sudden postpartum causes can result from cardiac, that is infarction, dissection, cardiomyopathy, neurological causes, that is stroke. So cardiac and brain naturally. Resuscitation with appropriate ABC measures are done. Respective specialties are consulted and patients is managed in ICU. So you should have a good team in your labor room, paramedical also. Well, last couple of slides. Take risk in your life. Very good from Swami Vivekanand. I know that our MC Patel is also very fond of Vivekanand. If you win, you can lead. But if you lose, you can guide. And the same message, same message. When you lose, anytime we obstetrician can have that problem. We are doing daily emergencies. So don't lose the lesson. No grief. Always learn from your lesson. Loss, and then it is the way forward. From the greatest personality of the millennium, in his preface of his textbook, he has written, I mentioned in each of my lecture, Ian Donald, I have to recognize if there is any classic mistake which I have not committed myself, it is simply because of lack of time in which to commit it. Because of cardiac reason and all that, he died at the young age of 58. But he clearly mentioned, if I would have practiced more, 10 years more, I would have done other mistakes also. So humble, so great man, Ian Donald. Nightmare, second message, you cannot avoid nightmare, Our labor room should be well equipped. Habit of regularly checking all labor room facilities, oxygen, suction, light, drugs, OT and trained adequate staff is very essential. If you do practice 5, 10, 15 deliveries a month, even that 5 deliveries, you must have everything available, And available colleague, phone पे advice नहीं देना, phone पे breach delivery कराते लोग, ऐसा नहीं होना है, You have to have rush team for you, rush span for you to tackle the nightmare in labor room. Develop, this is my personal again, develop passion for vaginal delivery. Dynamics of labor breaks for time. Price of successful obstetric is always patience, Mother Nature is the great obstetrician. Please, please, please control your cesarean section rate. In teaching hospital, we are seeing 40, 50, 60. Private, okay. But teaching institute also 40, 50, 60%. That is not good. 30, 35% is just pardon, Okay. Thank you very much. Thank you very much.
Yes, chairperson, expert comment, Dipesh bhai.
Sir, I have taken 5 minutes more.
No issue, no issue. Dipesh bhai, you are muted. Please unmute. Dipesh bhai, you are muted. Please unmute.
Other chairperson. Soni sir.
No, Paresh bhai, you are excellent and you have almost narrated all the emergencies and whom we called it's a nightmare. So thank you very much.
You are in Himmatnagar conference, you are teaching packing, everybody.
Definitely, I will have my special video on that.
Great.
Yes, Dipesh bhai.
Dipesh bhai.
Can you hear me?
Yes, you are audible.
Yeah, Aresh bhai, you are a great obstetrician and you have narrated all the complications in the labor room. But in our times, we have seen that half baby inside, half outside. They are also nightmares for us.
Yes.
Because the swelling of the baby and head is inside the uterus, we have to so many times recapitate the head and remove the half of the baby from below and half of the baby from above. So this, in this modern obstetrics, this should not be occur. Even we have seen the hand is outside in transverse line.
Yes.
But at that time, we don't have ultrasonography machine in our labor room. We cannot diagnose in time. That's why such complications are going to occur. But now in modern obstetrics, be careful. Even cord prolapse should not occur. You have to diagnose the cord presentation first because of the color, all these things. You have to diagnose early. That God presentation is there. So not a single mistake is pardonable nowadays, sir.
Yes.
Should be very cautious in labor room now. We must have all the facilities to revive the patient, revive the baby, because in this medical legal era, we no one is forgive us for any mistake. So be always prepare to tackle such problems. And you have so our nightmare comes into daytime obstetrics now. So there is no nightmare now. We are doing all in the daytime. So there is in day we cannot see these nightmares in the daytime to practice our obstetrics very safely. Thank you very much, Aresh bhai. You have done wonderful job and give
Thank you.
important messages to us. Thank you very much.
But always keep a number of MC Patel with you. Complication occurs. We don't want complications.
Sir, teamwork is required nowadays.
Yes, you are right. You have stressed clearly.
You require always
Medical legal point you have stressed clearly.
and good setup in your premises.
Also a number of Dipesh bhai also to help.
Yes, you cannot afford.
To shout.
Haresh sir, that was an excellent presentation, but would you please mind stop sharing?
Okay. Sure.
Thank you, sir. Thank you. MC sir,
Yes, we can
anything
proceed.
else from our chairpersons? Or we proceed to the next?
Jignesh is there? Jignesh? He's not there.
I do not see him.
He's not there.
Haresh sir, excellent talk.
Thank you, madam. MC Patel,
Yes.
after you get elected, then also continue with webinars.
Oh yes. Oh yes.
Yes, sir, please.
A very important, informative, right, series.
Yes. That is our.
Haresh sir, congratulations, one more. You sent all those messages for ICOG, you didn't have to.
Yes.
Totally unnecessary.
Madam, please. Thank you. Help me, MC Patel, help me in providing the list.
Yes.
So sir, should I start now?
Oh yes.
So we are much in time, and now we are going to start the reverse panel. We have our panelists who are going to throw questions at sir, and sir is going to answer them. I will be just moderating them. So it's my honor to introduce MC sir. Again, Atul Munshi sir is still here, so I'm afraid to introduce in detail.
No need. We can proceed.
So, sir is our presidential candidate going for election 24. That's me. And these are our panelists. I will take the panelists one by one. There is one request. If somebody is not present over here, then I request some other panelists to just take up that question. That way we will be saving on time. So, sir, I'll have to stop sharing. I made the same mistake again.
शुभं करोतु कल्याणं आरोग्यं सुखसम्पदम्.
Respected seniors and dear colleagues, serving Foxy for years together, on this auspicious day, with folded hands and down head, I seek your guidance, blessings, and support to endorse my candidature for the post of Foxy President, year 2026. election year 2024, consistently working for Foxy and trying to visit even a smaller societies and to assist our common Foxian friends in any given situation. I have tried to serve Foxy. I assure to serve Foxy in the same way with the same zeal and enthusiasm. पथ का अंतिम लक्ष्य नहीं, सिंहासन चढ़ते जाना, लिए सभी को साथ, आगे है बढ़ते जाना.
Thank you, sir. With this, we will be starting the session. Dr. Vasavada is here. Sir,
Yes, Vasavada sir.
Sir,
We
you may
can-
please
Yes,
bless us with your words of wisdom.
I'm trying.
So we can hear you now.
Yes, Vasavada sir.
Sir, please remove the speakers, then we can hear you. Remove those speakers. Remove the speaker from the laptop also.
Okay, you can hear me?
Now speak.
Now, yes, yes.
Yes, now we can hear you.
Okay, thank you. Thank you very much. Respected convener, Dr. Asha Jain, Program Director, Dr. MC Patel of Happy Learning Masterclass, Chief Guest, Dr. Atul Munshi, fellow guests of honor, Dr. C.B. Nagori, Speaker Harish Doshi, and all the panelists, and presidents of the All North Gujarat OBGYN Society, fellow obstetrician. Good evening. I'm honored to be here today to this webinar jointly organized by Happy Learning Masterclass and SOGO on a very interesting subject. I am sure deliberation will be useful in day-to-day practice. I sincerely thank convener and program director for inviting me as a guest of honor. I started my practice in 1974 and retired in December 22 after 49 years of service. Smooth, successful journey. I asked myself, how could I do it? There were many reasons. I used to reach hospital within 10 minutes of the emergency, conducted almost all the deliveries, and strictly maintained hospital timings. Litigations. As you know, last 3-4 years, cases against us have gone up and high number of times. We would be more careful. We should be more careful, more vigilant, and sincere in writing every decision in the case sheet. Because cases in the court comes after many, many years, but not written in the case sheet help us to clear the matter. The result will come in our favor. Never rely on juniors, non-doctors, irrespective of the experience. As you know, no NC patient once come to you, they never leave until unless you are not available. Because patient has taken many opinions, advices from different people, then they have chosen you, and that is why once they come, they are going to stick to you. Time has come. Because of the cases, we have to be more sensitive in our approach, have a sympathetic approach towards the patient, when a confidence of the patient, always have a free and frank discussion with the relatives, always seek a fellow obstetrician help and expertise. Remember, patient comes with a complication, you have not produced the complication. So after a sincere examination, always discuss with the relatives and with the patient and decide the line of treatment. And the last comment is we need to uphold the trust the public has placed on us by ensuring effective self-regulation. Thank you very much.
Thank you, Osawada sir, for your expert comments and sparing time for this webinar. Thank you, sir.
You're welcome, sir.
Thank you, sir. Thank you
Thank you, ma'am.
for waiting to give your message for so long. Thanks a lot. So my first question will be asked by Dr. Mukesh Savalia, sir, who's the president of Ahmedabad Society, and his hobbies are basically ghumna firna, to move around, to travel. So over to you, Mukesh, sir.
Dr. Savalia is there, or any other panelists can take.
Dr. Mukesh Patel, are you there? Dr. Mukesh Patel?
No issue, any other panelists can take.
Dr.
I think
Priyanka?
Dr. Ashavan, I think I would start with. I can't see.
Yes, sir. Yes, sir. Please proceed.
Well, I would like to take the question of this Mukesh Savalia also. Dear Dr. MC.
Yes.
Good evening.
Yes, good evening.
This is the most important question. What is POCSO Act? Does it cover the boys? How much is the punishment? And what is the amendment? I think this is the very prime question.
Yes.
I would like to ask some other question also, but let us start with
yes.
as Mukesh Savalia is not around.
So, as far as this POCSO Act is concerned, it is prevention of child sexual offenses. And this act was enacted in 2012, and it covers children. So any child less than 18 is child as per POCSO Act, and it is gender equal. So POCSO Act addresses boys also, and there are stringent punishment as far as provision of punishments are concerned, starting from 3 years of imprisonment to lifetime imprisonment, and in few of the cases, death sentence is also awarded under POCSO Act. And as far as this amendment is concerned, in 2019, some amendment came that whichever fine is awarded, then the amount collected from the fine should be given to the victim for treatment part and for rehabilitation, was the amendment in POCSO in 2019. And at the same time, there was amendment in IPC also, section 376 B and E. So any child less than 16 is a victim by one person or more than one person, then in this situation, imprisonment could be lifetime. And when child is less than 12 years, then imprisonment could be death sentence also. And not the one person, but all the persons involved in the act may be punished. So these were some stringent amendments as far as punishment part is concerned in POCSO Act.
Thank you very much. As you have emphasized too much on the age and yes, punishment differs according to the age, I would like to ask one more question.
Yes.
Can I, Dr. Asha Jain?
Yes, sir. Yes, sir. You're most welcome.
Coming to the age factor, as you have emphasized on age, isn't it, Dr. MC?
Yes.
A 17-year-old girl has a relationship with her boyfriend, and suddenly she realizes that she is. Hello?
Kiran, sir. Sir, is that the question that was given to you?
I think so.
Sir, don't ask it right now. We have to go as per, so that we cover the whole act. We'll come back to you.
Oh, no problem.
We'll come back to you, sir. So this is a question. This was for Dr. Mukesh Patel, sir, but I think he's also not there. Anybody can ask this question? Dr. Priyanka? You are muted. You are muted.
Yes, yes. I unmuted it.
Hmm.
Am I audible?
Yes.
So questions are what is sexual harassment? What is sexual assault? And what is aggravated form of sexual assault? And what is penetrative?
Please ask one by one. Please ask one by one as per the answers.
What is sexual harassment?
So as far as sexual harassment is concerned, any person with sexual intent, here in POCSO Act, word sexual intent is very much important. So any person with sexual intent utters any words or makes any sign or expose any part of his body or make child to do so is a sexual harassment. In this, no need to touch even. And one more thing, if he follows child and he utters some words or he shows some picture or he follows child on social media, it is also kind of sexual harassment. And many times when there is a threat to the children or child about in this media also with sexual intent, then also it becomes a case of sexual harassment. So repeatedly or constantly follow your watches the child and directly or through electronic or digital media is an act of sexual harassment. Yes, next.
Next question is what is sexual assault?
So in again this sexual assault also, whosoever with sexual intent, again word sexual intent is very much needed, touches vagina, penis, anus, breast of child or makes child to do so with that person or with another person, then it becomes a case of sexual assault. Here there is no penetration. It is simply touching. So to touch vagina, penis, anus, breast of child or make child to do so with him or any other person, it becomes a case of sexual assault.
What is aggravated form of sexual assault?
So when a child is mentally ill or any person under whose custody child is, that is a custody of faith, we can say. So any family member, in a hospital doctor, in a jail police superintendent, in school teacher, so they are in a position of faith. And if they involved in sexual assault, all these acts are considered as an aggravated form of sexual assault.
What is penetrative sexual assault?
If there is penetration of any part of body in anus, in vagina, in mouth, it is called penetrative form of sexual assault. And not necessarily it should be penis also. Any part of body penetrating in any orifice, it is considered as a penetrating form of the sexual assault. And if one makes child to do so, then also it becomes a penetrative form of sexual assault. And here it is not necessary there should be full penetration. Even mere small penetration is also considered as a sexual assault, type of penetrative sexual assault.
And what is aggravated penetrative sexual assault?
It is just like sexual assault. When patient is mentally ill or mentally challenged, and when person is in a position of trust, then it becomes a aggravated form of penetrative sexual assault. Just I mentioned any family member, in school teacher, in a hospital doctor, or in a jail superintendent. So these are the persons in a position of trust. And if they are involved in penetrative form of sexual assault, it is considered as a aggravated form of penetrative sexual assault.
Thank you, sir. Well explained.
Yes,
Thank
next.
you, sir. So this is Dr. Priyanka. She loves reading and traveling, and this is her photograph from Kashmir. She's a senior consultant at Gandhinagar. You've already been introduced to her, but now this is her.
We can skip that part of them.
Yes, madam. Yes, Priyanka, welcome.
Yes,
Dr.
sir.
Priyanka?
What was amendment in IPC related to child sexual offences?
So I mentioned already under section 376D and 376DB, it was amended in 2019, and in that amendment, when there is an offense in a girl less than 16, and when one or more persons are involved, each and every person will be punished as if they are involved individually. So whichever the punishment will be announced will be to all the person who are involved in the act. And it could be up to life imprisonment also. And if child is less than 12, and if one or more person, more than one persons are involved in this sexual assault activity, then one and all will be punished with the same punishment, and many times it could be death sentence also. And in few of the cases when there is a sexual assault, it could be penetrative form, and if there is a murder of child, then death sentence could also be awarded. So these were some amendments which were made in Indian Penal Code in 2019.
And which are provisions for child pornography?
So the same, as far as child pornography is concerned, if any child is used as a subject in pornography, then it is considered as a child pornography. And there is a stringent punishment in this act also in POCSO Act. And one more thing, if any person is involved in that pornography as a subject, then all the section of sexual assault, penetrative form of sexual assault, or aggravated form of sexual assault and aggravated form of penetrative sexual assault will be charged to that person. But if simply child is used for pornography, he or she has not been involved, then only section for use of child for pornography will be applied.
Thank you, sir.
Thank you, Dr. Priyanka. Sir, now we have Sandeep Patel, sir, but I don't know, I can't see.
Yes, he
Yes,
is there.
yes,
madam. Yes, Sandeep.
Sir, he is the
Am I audible,
president
sir?
of Himmatnagar Society, and his interests are music, singing, reading. So over to you, Sandeep, sir.
Thank you, sir. Thank you, madam. Good evening, sir.
Good evening.
Thank you very much for inviting me in a happy masterclass. Because of you, sir, we can learn many things on webinar. Now your question is, a 17-year-old girl comes with her boyfriend. She asks for contraceptive advice. What will you do? Can or will you advise or not?
So here there are two situations. On one part, legal part, and on other part is a moral duty. If we do not advise contraceptive measures, and if they have decided to go for active sexual life, then she may end up into unwanted, unplanned pregnancy. And again, she will be to us only for termination of pregnancy. So that is moral part. But as far as legal part is concerned, she is less than 18. So she is minor. And if you advise, then it may become a case of abatement. What is abatement? Abatement means to instigate any person to constitute crime, to help any person to constitute crime, or to aid any person to constitute crime. So in this type of situation, investigating officer may interpret that you help that very person to constitute crime. So it is very tricky situation in this type of situation whenever patient less than 18 years comes to us for contraceptive advice. Of course, we can teach them as far as health education is concerned, but you cannot prescribe any contraception. Because if at all you prescribe, then it becomes a proof that you have encouraged them to constitute crime because they are less than 18. And in this situation, if you have advised it to girl, then it becomes less problematic because if you have advised boy, and if boy commits any sexual assault, penetrative harm or so with that girl, then it becomes a case of abatement that you help that boy to constitute crime. So it is very difficult situation. So better not to prescribe any contraception on paper, but you can guide them not to have unsafe sex or not to have sex and it ended into pregnancy.
Yes, sir. Thank you, sir. Thank you.
Thank you. Yes, next.
Next, we have Dr. Sapan Doshi, sir. And he's the secretary of Himmatnagar Obstetric Gynec Society. Again, his hobbies are romantic songs and traveling. So, Dr. Sapan Doshi, sir, over to you.
Is Sapan Doshi there?
Yeah, he's there.
Sapan.
He's looking half asleep and yeah. Unmute, sir.
Am I audible?
Yes.
Now you are audible. So
Yes.
I think this question is covered by Sandeep Patel. Next, Asha.
That was the previous one.
Yes. Asha, next.
It's here, sir.
Okay. Okay. So thank you everyone for inviting me. Now my question is, 16-year-old girl is brought by her mother with complaint of vulvovaginitis with discharge per vagina. On examination, she is found to be a case of STD. Now she gives a history of sexual exposure with her boyfriend. And what will you do? So how we should proceed in
Here patient is less than 16 years. And on examination, it is found to be a case of STD. And she gives history of exposure. So it becomes a case of POXO. You have to treat patient naturally, but you have to inform police. As far as her vulvovaginitis part is concerned, her STD part is concerned, you have to treat patient. You have to go with prophylaxis for HIV also in this type of situation, and you have to inform police.
Okay.
Thank you,
Thank
sir.
you.
Sir, next we have Dr. Mukund Patel, sir. He loves photography as well. He is the president of Mehsana Society, and these are the images that he has shared of the Niagara Falls. So,
Yes, Mukund Patel, welcome. Is he there? Mukund Patel? Okay, anybody can take.
Anyhow, 18 years and 6 months old married girl is brought by her mother with pregnancy of 39 weeks, and she is for LSCS. What will you do?
So here again, patient is 18 years and 6 months. So she is
Right.
major, but she is having pregnancy of 39 weeks. So at the time of conception, she was minor. So it becomes a case of POXO. So you proceed with delivery, whether it is normal or whether it is cesarean section if it is indicated. But before this patient leaves your premises, you will have to inform police.
Will you proceed with LSCS if indicated?
Yes, we have to treat patient first. No, because in very famous case of Parmanand Katara, court has very specifically mentioned first you treat the patient and all the legal formalities afterwards. But before patient leaves your premises, before you discharge patient, police should be informed.
Is there any issue of child marriage?
So here in this case, actually, this is of course child marriage, but it is irregular marriage. In eye of law, it is not invalid marriage, it is marriage but irregular marriage. So in irregular marriage, any party declines to continue marriage, then that marriage is null and void. But in this situation, many times this type of situation may occur. They are already married, they are happily enjoying their marriage life, and they are brought for antenatal checkup or for delivery. But when patient is less than 18, it becomes a case of POXO, and you have to treat patient, but at the same time, you have to inform police.
Thank you. Thank you very much.
Thank you, sir. Maybe proceed with the next question.
Yes.
So I don't see Dr. Priyanshu Patel.
I'll do for you.
Yes.
Yes, sir. He
Vasavada
is
sir
the
is more.
trekker and he is also the secretary of Mehsana
Secretary of
Society.
Mehsana
But, sir,
Vijay Society.
when is the- Yes, sir.
Yeah. 17 years of girl, old age girl with mother visit hospital with 6 weeks of pregnancy for termination of the pregnancy. Doctor explains to inform the police. Patient and mother refuse to the same and leave the hospital without taking any treatment further. What will you do?
So in this situation also, whether patient takes further treatment with you or not, but once you come to know that she is pregnant, she is less than 18, it becomes a case of POXO and you have to inform police.
Thank you.
Yes.
So, sir, here we have Dr. Naresh Prajapati. I saw him. He's there.
Yes.
Yes, madam.
Yes,
Good
sir.
welcome.
Good evening,
Welcome. You did
everybody.
send me your yoga pictures. So he is a yoga enthusiast. He loves traveling, loves exercising and yoga. Also
Yes, ma'am.
the president of Palanpur Society.
Yes, madam.
Yes, sir. Proceed.
Yes.
MC Patel, sir. Good evening, sir.
Good evening. Good evening. Welcome.
Yes, sir. Sir, my question is, what is the role of doctor when victim is come below under 18 when comes in emergency?
So whenever victim is brought to you,
Yes, sir. What is our role of doctor?
Yes.
Role as a
so
doctor?
there
What
are
should be
two
the
situations. There are
Yes.
two situations.
Yes, sir.
Victim is brought by her relative or victim is brought by police. So if she is brought by her relative, then you will have to inform police, one thing.
Yes,
And
sir.
if she is brought by police, it's fine. Now you will have to examine patient, but before examination, you have to take consent. So patient will give consent for examination and then you will proceed for examination. And before you proceed with examination, you will ask certain questions. When this incident happens, because if it is fresh one, it is easier for us to opine. But
Yes.
if it is an old incident, say for example, 1 month back, and
Yes.
when patient is brought, then it becomes very difficult for us to opine. So time since this incidents happen, history of bath after incidents, history of change of clothes after this incidents. So these
Yes.
are certain history you have to ask for before going for examination.
Yes, sir.
And if she has given consent, then during examination, you will have to see injury marks near thighs, near perineum, on breast, on face, or any other part of the body. And you will mention all these injury marks, any discharge, any bleeding part, any stain on thigh, perineum, or any other part of body, stain on clothes, stain of blood, saliva, semen.
Yes, sir.
So you will have to mention everything in your report and you will have to treat patient. So naturally, whenever patient is brought in this type of situation, patient has all the right to be treated. So we have to treat patient and we never know about accused. So we will have to give prophylaxis treatment of HIV also to this
Okay.
patient. And
Yes.
after all the injury mark, you have to come to conclusion whether she is a victim of sexual assault, and you will have to inform police with your opinion. So you will form opinion. So you will take consent, you will take history, you will examine, you will form opinion, you will treat patient, and you will inform police. So this is the role of doctor when victim is brought to him.
Sir, one question in my mind.
Yes, yes.
Sir, I am a private practitioner. 2 to 3 times, only 12 to 13-year-old female patient come with her mother or relative. They say only ke bleeding per vaginum since 3 to 5 days on and off. And when we see with our sister, then some type of some conclusion or some types of injury, and we always have a doubt that this patient may have a sexual assault. So in that type of situation, actually, as a private practitioner, I told to her relative and them, okay, you go to the civil hospital and complete your procedure. We can't give any evidence, and that type of situation we routinely tell to the patient and relative. So this is the ideal thing, or we should compulsory we should attend that patient.
In this type of situation,
yes,
if you are of a opinion, even your staff sister has examined her in your presence, and if you are of a opinion that she is a victim of sexual assault, even you do not treat that very patient further, and if you refer patient to civil hospital also, then also you have to inform police, because under section 19 of POCSO Act, being a responsible citizen of India, as soon as any person comes to know that it is a case of sexual assault, or if you presume, then also you have to inform police that it could be. So further investigation will be taken by police at civil hospital or so. But once you come to know, you are under obligation to inform police.
Okay, sir. Okay, sir. This type of situation I come across in one and I refund the money to patient, and I always take
it doesn't work in court of law. And if investigating officer is smart enough to harass you, then they can harass you.
Okay, sir. Okay, sir. We should inform the police.
Yes,
and
we should inform police whether we treat that very patient at our place or we refer patient to higher center for further treatment. But before you refer patient to higher center, you should give some primary treatment, because without doing anything, you cannot refer. So when you examine that very patient, even if you are going to refer, then also you will have to mark all the injuries marked, because many times police will ask you also to opine. So what is your opinion? Whether she is a victim of sexual assault, and you have to opine. So you have to make all the case paper in detail, and then you can refer patient to higher center.
Okay, sir. Okay, sir. Thank you very much, sir.
Yes, welcome.
Thank you, Naresh, sir. That was really elaborate. And do we have Dr. Dignesh Bhalkia? He is the Secretary of Palanpur Society.
Yes, ma'am.
Yes, welcome, Dignesh.
Yes, good evening,
His
sir.
hobby is listening to music, sir.
Good.
Yes, sir. Proceed.
Yes, good evening, sir.
Good evening.
Sir, my question is that if we fail to report any case due to any reason, what is the provision for that? Can we inform the later, or how to proceed for that?
Actually, just I mentioned prior also in one of the discussion, before patient leaves your premises, you are under obligation to inform police under section 19. And if you fail to report, then under section 21, there is a provision of imprisonment of 6 months and fine and both. So if you can afford 6 months imprisonment, then you can afford to fail to report. But if you cannot, then you have to inform police. And how to inform? It is also... Yes.
Sir, is there any time limit within that we have to inform?
Yes, I mentioned before patient leaves your premises, you have to inform.
If the patient
Because
is in
what
OPD.
happens, your intention is good, you have to inform police, but patient leaves your premises and due to some workload or so, you didn't inform, or you couldn't inform. And that very patient goes to police station and file a complaint against that accused person. Then police will be to you why you didn't inform.
Okay.
So in this type of situation, it is always better to inform police, before patient leaves your premises. And
And
how
sir-
to inform, it is
Yeah.
also very much important. You should inform police with acknowledgement, because many a time police may go hostile. You didn't inform. So we should have a proof of informing police in this type of situation. So have a signature on case, letter which you have sent to the police. You send 2 copies to the police, and in 1 copy it should be acknowledged. Name of that person who has signed that document, date, time, and if his police station officer, then buckle number. His buckle number should also be mentioned in that. Many a time police may refuse to give signature or give acknowledgement. Then in this type of situation, there are some other ways also to inform. Say for example, have a phone call to 100 number. It is recorded call. But in this situation also, first you identify the person whom you are talking. So what is your name? What is your buckle number? And mention date and time in this. One more thing, if you can, you can send register ID letter also. If police has refused to give acknowledgement, then the same letter should be sent by register ID post. You can have a mail also. If you have email ID of nearby police station of your jurisdiction, you can mail, because all this can be proved in court of law that you had informed police. And one more remedy, if lower police officer is not complying, then you can inform higher officer also. And if there is a child welfare committee in your district, then you can inform member of child welfare committee also. And once you inform child welfare committee, then the whole situation will be taken by child welfare committee, and they will proceed to the police and they will deal with the police. You are out of problem. You are simply informer. You are not complainant. You have to simply inform either to police or to CWC.
So either of that.
Yes, yes. But acknowledgement, even if you inform CWC member, then also 1 copy should be signed by the person whom you have informed.
Yes. Thank you, sir.
Because in some of the center, there are 1-point center. So in this type of situation, whenever there is a sexually harassed victim, they are brought to that 1-point center. And from there only, they will bring that very patient to a doctor for examination, for opinion, and for treatment. And if doctor is available in that very center, then patient will be taken care immediately at that center also. And all these centers are run by government.
Thank you, sir.
Yes.
Now, our next panelist also I do not see. He is Dr. Dinesh Patel,
So
past
Mahendra bhai can
president of
take.
Himmatnagar. He's been president for 17 years.
So Dr. Mahendra Soni is there from Himmatnagar. He can take question for Dr. Dinesh Patel.
Soni, sir?
Soni, sir.
Yes, Mahendra bhai, please unmute. Mahendra bhai, you are muted. Please unmute. Any other person from Himmatnagar?
Yes, it's okay.
Yes, yes, welcome.
Let me see the question. So the question is, what's the duty of the doctor?
So, of course, I have mentioned prior also to deal with the case of sexual assault. So, to take consent, to examine patient, to mark injury marks, to give prophylaxis treatment, prophylaxis for HIV also, to form opinion, and to inform police is the duty. And
Can sedation be considered for examination of victim?
yes, if patient is not comfortable for examination without sedation, you can consider sedation also. But if at all you are going to go for sedation, then consent from guardian is very much required, because in this situation, when patient is minor, she cannot give consent for sedation or for anesthesia. So you will have to take consent from guardian, and you can consider sedation for examination.
Right. Thank you.
Thank you. Welcome. Next.
Thank you, sir. Thank you, Soni sir, for coming in. Sir, the next question, Dr. Sanjay Dharani.
Sanjay Dharani.
The past president of
Palanpur.
Palanpur Society. Dr. Sanjay,
Yes.
Yes,
Good evening,
welcome.
sir.
over to you.
Good evening, sir, and thank you for inviting me here.
Yes.
My question is, who can give consent for examination of victim?
So if patient is more than 12 years, patient herself can give consent for examination. But if at all we have to go for any intervention, say for example, if she is bleeding and we have to go for stitch, or there is some foreign body inside and we have to deal with accordingly, then in this situation, consent of guardian is required, because she cannot give consent for surgical intervention.
Okay. So more than 12 years can give
Yes,
consent.
she can give consent for examination, because
Yes.
when she is more than 12 years in eye of law, law consider her to be a mature minor. Of course, she is minor, but she is mature minor and she is able to give consent for examination.
Okay. And the second question is, if victim refuse for examination, then what to do?
If she is more than 12 years, she can refuse. And if she refuses, you have to enter into the record that patient is not willing to go for examination. So negative consent should also be taken. I am not ready to be examined. And at the same time, you have to explain her what is the disadvantage of not to be examined. Because if this is a case of sexual assault, and if we do not examine, then how we can come to conclusion? Many times patient is not interested to reveal name of accused also. So in this type of situation, if patient is more than 12 weeks and if she refuses for examination, we cannot force for examination.
And if victim is refusing,
MC,
but relative are
MC,
insisting,
can
then
I
what to do?
intervene? Can I
Yes,
intervene
yes,
for a second?
Yes, yes, yes.
If at all you are taking a negative consent, is it necessary to take the signatures of the two independent witnesses in
Yes,
that?
naturally. When we take negative consent or even positive consent, then also as per Indian Contract Act, we have to go with two witnesses. One witness in favor of patient and one witness in favor of hospital.
Okay.
Okay, sir. And if victim is not willing and relative are insisting for examination, then what to do?
No, if victim is more than 12 years and if she is not willing, we cannot examine.
Okay.
And relative cannot insist.
And if victim is willing, but relative are not willing.
If victim is willing and if she is more than 12 years, we have to examine. Here consent of relative for examination is not required. If any surgical intervention is required, then only signature of guardian, consent of guardian will be required.
And sir, what is the provision about presence of parents or relative during examination?
So under POXO Act, we can allow any relative of our parents during examination, examining room. But before that, we will have to ask that very child, because child may not be comfortable to be examined in presence of some of his or her relative. And many times it may happen, the person who has brought that very child could be accused, because we never know. In many of the cases it has happened that family member or relative who has brought child to the hospital is accused. So many a time in his presence, child may not be comfortable to be examined. So we will have to ask child first, are you comfortable? If he or she remains present inside, and if child is comfortable, then we can allow. It is allowed as per POXO Act also.
And so last question. I am recording this whole webinar on my mobile as a screen recording.
Yes.
Should I share to my friends this recording?
Yes, but for that also consent is required.
That's why I'm asking a
So
consent.
even if you do not record, then also just this program is over. Recording is available with us, and we put that very recording in group also.
Thank
For
you
each
very
and
much,
every
sir.
webinar, we put recording in group immediately.
Thank you, sir. Thank you.
Yes.
Thank you, sir. So, sir, we proceed to the next
Yes.
question.
Yes.
So this is Dr. Hemant Bhatt. His hobbies are reading and social work, and as you can see, he is a performer. So
Thank you, ma'am.
And one more thing, Dr. Hemant is our media in charge of BJP Gujarat State.
Thank you, sir. Thanks a lot.
okay. That he did not tell. I kept asking him. He didn't tell me.
And he appears in so many TV talks and debates on behalf of BJP.
Thank you, sir. Obliged.
Okay. So
At the
this is
outset,
question, sir.
let me congratulate Dr. MC Patel for this wonderful masterclass today and a wonderful insight in the POXO Act. And according to my duty, I must ask the question. And the question is, what is the role of a doctor as an expert witness in a case of sexual assault or a rape?
So doctor is the first point concerned person for any victim of sexual assault to be examined. So he is the key person as far as expert witness or expert opinion is concerned in court of law. So whenever he comes with opinion, whenever he forms opinion and he submits his opinion to police, the same will be in due process, in due proceeding in the court. He will be invited by court to give his expert comments, his expert witnesses in court of law in sexual assault and rape cases.
Okay. And the second part of my question is, can a doctor refuse to examine a victim of a sexual assault who come to the hospital for a treatment, citing that it is a case of an assault, it is a medical legal case, and it requires a police requisition or a magisterial order?
So under section 27 of POXO, it is very specifically mentioned, it is a right of victim to be examined and to be treated by doctor, irrespective of requisite from police. To examine patient, to form opinion, to treat patient, requisition from police is not required. First, we have to examine patient, treat patient, form opinion, and we have to inform police. So if patient comes alone or patient is brought by some relative without police requisition, then also we are under obligation to examine, to treat, and to form opinion, and to inform police, of course.
Thank you, sir. And best wishes from all of us from Gujarat as well as from the lovers from all over India for your coming presidency of FOXI. May you win with a very thumping majority.
Thank you, sir. Thank you.
Thank you.
Yes, next.
Thank you, Hemant, sir.
Thank you, ma'am.
And now we have Dr. Jignesh Deliwala. He's a tennis player and loves reading books. Jignesh, sir, are you there? I saw him. Yes, sir.
Yes, he is there.
I can see you. Please unmute yourself.
Dr. Deliwala, please unmute.
Good evening, everyone.
Yes, good evening. Welcome.
The happy master class joined. And I must congratulate Dr. MC Patel for this excellent webinar on POXO Act. And we wish from as a OGS society that you your presidential election and with you will win with a thumping majority.
Thank you. Thank you.
So my question is, the 17-year-old girl visit a private hospital with a history of sexual assault, and the doctor asked her to go to government hospital. So is it a MNC case and has to be examined by the government doctor? Is it necessary? Is it mandatory that a victim of sexual assault must be examined at a government hospital?
No, it is not at all mandatory. Patient can be examined by any doctor whom patient is brought in this type of situation. And just I mentioned prior also under section 27 of POCSO, patient has all the right to be examined by any doctor, any registered medical practitioner, irrespective whether he is at private or he is at government, can examine patient, can treat, can form opinion and inform police.
I think it's a recent amendment, Dr. MC Patel, or it is already the act was enacted when these changes were done afterwards.
No. From beginning also. And other than POCSO Act also, any person, whenever brought with a history of sexual assault, doctor whom patient is brought to is under obligation to examine patient and to treat patient and then to inform police. Since beginning it is there.
Yes, but because there is a list of documents that you have to provide during
Yes.
the examination of a sexual assault, but as a private practitioner, I may not have this type of experience, or I may not have this type of documents. So in that case, what should I write, or what should I keep a record that police can ask afterwards?
Yes. There is a prescribed kit for this type of cases to be examined. So which kind of specimen we have to collect for evidence. So in that very kit, everything is mentioned. So if we do not have that kit, then we can inform police that this victim is brought to me, but I am a private practitioner, I do not have all these kits, etc. Should I send patient to nearby government hospital? But once you inform police, you are out of purview of this POCSO section 21, not to inform, failure to inform police. So you have to inform police, and you can mark simply some injury mark, major injury mark, near perineum, near thigh, on breast. So if at all you have to opine your first look at the patient, you can opine something. And then you can, with, of course, informing police, you can refer patient to higher center.
Okay.
But straightway without doing anything, you cannot refuse, or you cannot refer patient to higher center that this is MLC case and I am not a government doctor, I am a private practitioner. So you please bring patient to government hospital cannot be the excuse on your part.
So I think its take-home message is it is not mandatory that the victim should be examined by the government hospital.
Yes, yes.
As a private practitioner, you also
Yes.
liable to examine her or him.
One
And my
cannot
next
refuse,
question.
one cannot refuse patient to examine and to treat in this type of situation. It is right of patient.
Yes. Thank you, sir. The next question is it necessary for a female doctor or only to examine sexual violence victims? I think recent also there is not necessary to female doctor. I think we should have nursing staff, female nursing staff.
No, it is preferable if female doctor is available, then patient can be or should be examined by female doctor. But merely on that ground that female doctor is not available, patient cannot be referred to government hospital or any other hospital. Even male doctor can also examine patient. Say for example, if patient is brought with history of sexual assault and she is bleeding and female doctor is not available, would you leave patient unattended? No, you cannot. You are under obligation to examine and to treat patient in that very emergency situation. So irrespective of whether male or female doctor, we have to attend patient. But if female doctor is available, then it is preferred to be examined by female doctor.
Okay. So I think thanks a lot, Dr. MC Patel, sir, for enlightening us regarding the POCSO Act, and my fellow panelists also will ask the questions. Thank you so much and wishing you all the best.
Thank you. Thank you.
So, sir, this is the official question for Dr. Kiran Desai, sir.
Yes,
He's the
Kiran
past president in Ahmedabad. Kiran, sir, if you are there.
Yeah, I am around.
Yes, sir. Please proceed.
Good evening, Dr. MC Patel.
Yes, welcome.
Well, it reminds me my old days to be a secretary of you.
Thank you. It was my privilege rather.
Yeah. The question goes like this: that a 17-year girl who is in relationship with a boyfriend and failed to get her next menses on a regular due date. Now she is very much anxious and visits the doctor. She is worried that she is already pregnant, and she discloses to the doctor about her physical relationship, sexual relationship with her boyfriend. She also discloses she's worried about her conservative parents, how they would react, whether they will allow her studies or not. So what should be the next step of the doctor?
So when she is 17 years and she is less than 18, so it becomes a case of POXO, because she herself gives history of exposure with her boyfriend. And so it is a case of POXO, and we have to inform police.
Whether to inform the girl's parents against OBC,
So no,
whether to counsel
here
about
patient is 17 years. So it is willingness on part of patient only. When she is more than 12 years, she can take decision whether her parents to be informed or not. If she refuses to inform, we cannot and we should not. Because it becomes a professional secrecy. And we cannot disclose personal information which we could collect during our professional career to any other person without request or without permission of patient, even not to parents also.
So the rights at the age of 12 are different, and the rights at the age of 17 are different.
Yes, yes.
Whether to counsel the girl about her safe sex and the advisor regarding
Naturally, just I mentioned prior also, we can give her health education, but cannot prescribe any contraceptive, because it may invite some more litigation for us also. Because it becomes a case of abatement. You are encouraging them to constitute crime in future.
Thanks a lot, Dr. MC, and wish you
Yes.
all the best for your president election.
Thank you.
You
Thank
are
you.
going to come out with flying colors. We are
Thank
sure.
you, sir. Thank you.
Well, Dr. Asaran Fagun is not around, and I'm going to take
So yeah,
his.
you can take.
Yes,
You
sir.
can.
Please take his
He
question.
conveyed the message to me. Same thing, a 17 years old girl had eloped with her boyfriend and became pregnant with somewhere around 16 weeks of gestation and requested the termination of pregnancy. She is not willing to reveal her boyfriend the name of the boyfriend, and requesting not to inform to the police. What should be done?
So
Mother
again,
is refusing to give the consent for
yes,
termination.
again, here is also it is a case of POXO. She is less than 18.
Absolutely.
And she is willing for termination of pregnancy. If our center is registered, we are qualified person, so we can terminate pregnancy of this very lady. But consent of guardian is required. So if her boyfriend is major, then her boyfriend can also give consent, or any other person. So here word guardian is used. What is the literal meaning of word guardian? Any person who guards the patient is guardian. Not necessarily he or she should be her father or mother. So any person who has brought patient to the hospital is guardian and can give consent. But person who is giving consent should be major, and he should be mentally sound. So in this type of situation, you have mentioned her father is refusing to give consent for MTP. What doctor should do? So any other person, if give consent, then you can very well proceed with termination of pregnancy. You can inform CWC also in this type of situation. And if any person from CWC, that is Child Welfare Committee, can give consent for termination of pregnancy, and you can very well terminate pregnancy. But in this situation, you have already informed police that she is victim of sexual assault under POXO. You will preserve product of conception in normal saline, and you will have to hand over that product of conception to the police as an evidence.
Oh. Is it necessary to have the second gynecologist opinion in this sort of cases?
No, here pregnancy is 16 weeks, and with newer amendment of MTP, less than 20 weeks of pregnancy, you can terminate pregnancy with opinion of one registered medical practitioner. So no other opinion is required nowadays with amendment of MTP in 2021. But here again, about this handing over product of conception to police also. If patient refuses to hand over product of conception to police, then when she is more than 12, she is 17 years, you have not to give product of conception to police.
Oh.
Because patient is at full liberty to take decision whether product of conception is to be handed over to the police for further investigation or not. So in this situation, when you take consent, you will explain everything to the patient. At the end of examination, I will have to form opinion, I will have to inform police, and if at all we are going to go for termination of pregnancy, I will have to hand it over product of conception to the police. And if she give consent for all this, then you have to proceed accordingly.
Thank you very much. Again, all the best for presidency. We all are with you.
Thank you, sir. Thank you.
Kiran sir, don't leave. You'll have to take the last part of this question.
I will. No problem. Anything
Because
for
Dr.
MC.
Bhavna Savalia is not there.
No problem. No.
So this
The
is a
question, the last-
continuation of the last one.
Continuation of that very case.
Yeah. The last question. Once it is informed to the CWC and the father has consented for MTP, then what to do?
Then the same case, in this very case, when CWC was informed, the father became ready to give consent for termination of pregnancy. But now some questions, you go with
MTP
questions.
was done and now father is insisting for the product of conception to be sent to the further investigation.
So in this situation,
But the girl doesn't want.
yes, so you cannot send, because when girl is more than 12 years and if she has refused to send product of conception for further investigation, even father insists, then also you cannot.
No, father would like to know the DNA.
Father would like to know, but patient is not willing. And it is a product of conception, it is a part of her body. She can take decision.
Not father.
Not father.
Argument of the girl is the product of conception were recovered from her body and she has the right. Oh, that's
Yes.
that's what you were telling it, mentioning it. Okay, thank you. So we know the doctor.
Yes.
What doctor has to do.
Yes.
Thank you very much, Dr. M.C. Patel.
Yes,
And
and
I
my
think,
humble appeal.
You are time.
Please
You are in
endorse my
time and dark 8
candidature.
PM.
Yes. So please endorse my candidature for post of President Foxy election year
You have not to
2024.
You have not
And-
to use
and-
word please.
Yes.
You have
and
to
all-
honor us.
Yes. All the president and secretary of respective societies who have joined, my humble request, you please inquire with your society, any member of your society who couldn't vote in last election. What was the reason? You can write to Foxy that these very members of our society couldn't vote. Foxy will give you reason, because many a time certificate of post-graduation degree or diploma is not with Foxy of that very member of your society. Then also Foxy will not send ballot. And one more thing, if you have not sent contribution of that very member to Foxy in time, then also Foxy will not send ballot to that very member. So it is very much required thing that each and every eligible member of our society, all the information should be with Foxy, and dues of membership should be sent before 31st of March. Then only all the members of our society will be in a position to vote. And each and every member of SOGO should vote. This will be the base for my victory. Yes, Vasavada sahab, any expert comment?
No, thank you. Bas, we'll try our best to give maximum vote to you, almost 100%.
That is for election, but for this POXO and any other comment?
This act POXO, it definitely will help each and every person, because they were, according to me, before that 18 years are major, below 18 was the minor. But now, as per you, 17 years, and after 12 years also one can give consent.
Yes. So
Hello.
If you refer section 375 of IPC, where definition of rape was given, and in our curriculum of forensic medicine, we were also taught. So in that very section 375, what is the definition of rape in those were under IPC? So any unlawful cardinal knowledge without consent, against her will, and even consent taken under intoxication or by wrong promise of marriage or wrong belief. When patient doesn't know whether he her husband, and he introduces himself as her husband, and if she believes that yes, he is her husband, and if she give consent, then also it becomes a case of rape. It was the definition. But in that very definition, there was one clarification. If she is less than 18, but if she is more than 16, with her husband, it doesn't become a case of rape. But if she is less than 15, even with husband, also it becomes a case of rape. Other than POCSO, I am talking of rape, section 375 of IPC. So it was there also in rape also before this POCSO Act, which came into existence in 2012 only. But after POCSO, it doesn't matter whether she is married or unmarried. It attains only age. And when she is less than 18, irrespective of her marital status, we have to inform police. Right.
So,
Dr. Soni wanted to say something.
Yes, Mahendra.
This is just one advice, because in our city only, my one friend was so harassed, because many times what happens, that a whole family comes, which is known to you. You know the family, that, and they say that yes, sir, this is my son and her wife, and now she's pregnant, and we don't want just now pregnancy. And lightly, you take everything lightly. You terminate the pregnancy. And what happened after 2-3 years? There was quarrel in those both families.
Yes.
And they were divorced. And after 3 years, that girl complained of her rape, and that this doctor, they they just brought me to this hospital, and this doctor had
it is very common scenario. At that point of time, they will refuse to inform police. We have no complaint against anybody. But for any reason, there is quarrel in between. Then after 1 year or so, they will lodge complaint.
After 3 years, they lodge complaint.
Then police will come to you. Why you didn't inform police? So,
and it's a crime at that time.
Yes, let me put one example which happened in state of Gujarat, only in South Gujarat. So, in this case, patient was major. Patient was major but unmarried. She came with her boyfriend for termination of pregnancies. When she was major, hospital was recognized, person was qualified. So, she went with termination of pregnancy. After 1 year, police came, and police told that doctor that now that very patient has lodged a complaint against that boy, that boy has declined from marriage, that promise of marriage. He had given me a promise of marriage, and that is why I gave my consent for intercourse. And now he is declined from his promise, and she lodged complaints against that boy as a case of rape. And police had been to doctor, and police simply asked to the doctor, why you didn't inform police? So in this type of situation also, we are in a very tricky situation, but not to end up into this type of situation in future. If patient is major, you can very well terminate pregnancy, but 3 lines in patient's own handwriting should be written. This is result of consensual sex. I have no complaint against anybody. I do not want to inform police. Because at that point of time, patient is very sure that she has no complaint against anybody. She has not to inform police, and this is result of consensual sex. Afterwards, if at all something happens, a thing cannot be taken retrospective. So doctor could be out of problem with simple these 3 lines. So we should have a habit in this type of situation whenever we are dealing with a termination of pregnancy of major patient but unmarried patient. Please make a habit to get it in writing by patient only.
But Manubhai, suppose at that time they don't say about marital status. They are married or not.
No, doesn't matter. If she is major, whether she is married, whether she is not married, you can terminate pregnancy.
And we will take consent. That's all.
Yes. I do not have any complaint against anybody, and I do not.
No, not like that. When one male person and female person comes to you for termination, and they don't say that they are not married or something like that.
So she will introduce that very person to her husband. So in this type of situation, it becomes a very tricky situation in view of the condition. But if you have a little doubt, you can ask for either marriage certificate, or you can have a writing in patient own handwriting. I am married, and a person who has signed as a witness is my husband. So if they have hide any facts, or they have represented any facts in a different way, then it becomes a case of forgery on them. Section 420, giving false information. So we are saved. But in this situation, writing on part of patient and person accompanying the patient should be there.
So in our party, we have taken consent at that time. That will be okay, right?
Yes. But if you are little doubt that they are not married, then also, if patient is major, it doesn't make any difference.
Right.
But if at all she is minor, then you have to inform police. Whether any relative of that very patient, they are much known to you since years together, they are or old patient as far as whole family is concerned, they will insist not to inform police. But just I mentioned prior also, under section 21 of POCSO, there is a provision of 6 months of imprisonment in failure of reporting. So it is very much important, or very much essential rather, to inform police, irrespective of any willingness on part of relative is not required to inform police. And we are not complainant, we are not complaining, we are simply informing that this patient had been to me, and during my examination I could found that she is pregnant, she is minor. It becomes a case of POCSO. Please do needful, that's all. We have not to insist police what to do. We are simply informing.
Right. Thank you.
Sir, so now is this the end?
Yes.
I would like to make my appeal to everyone from your societies. Please nominate me for Food, Drug and Medical Surgical Committee, election year 2024.
So Dr. Asha Jain is working with me in this series since more than 2 years rather, and she is very deserving candidate for that this very committee. So at the time of nomination, all the society president and secretary will have to nominate Dr. Asha for this very committee and Dr. MC Patel for post of president, first nomination. And at the time of voting, for me, each and every member will vote, and for Dr. Asha, society will vote. So society with less than 200 membership will have 1 vote, more than 200 will have 2 votes.
Sir, more than 100 will have 2 votes. So less than 100 is 1 vote.
Yes. So if they have 1 vote or 2 votes, then in that very situation, they have to vote for Dr. Asha for this very committee.
Sure. Thank you.
So thank you. So if any suggestion, you can put in group also. Yes, we have a small temporary group. We will close that group within a few days as soon as this link of this recording is available. If any suggestion to make this type of program very useful and very palatable to the delegates, because we discuss today, we have discussed POCSO Act. The same way we discuss MTP Act, we discuss documentation in our OBGYN practice. we discuss CPA cases, we discuss criminal cases against doctor in this type of reverse panel. So these are some areas as far as medical legal consequences are concerned. We have started in our 4th round of this series reverse panel. Otherwise, previously we were doing regular panel for clinical cases, and I was taking one talk about medical legal consequences. But now we have changed this. So we invite your suggestions to make this program much better.
Sir, may I say a few words? Nilesh?
Yes, ma'am.
Nilesh?
Yes.
Please
And-
stop
and
live sharing.
Before Nilesh take over,
Please-